y'all, welcome back to the channel. It is winter, it's January, days are short. This time of year, especially when the time changes, kind of pulls you into this whole like hibernation mindset. For some of us, it can really have a negative effect on our mood, and that's where seasonal affective disorder comes in. So let's get into it. So what exactly is seasonal affective disorder? So in the DSM-5, which is the diagnostic manual we use when diagnosing mental health disorders, seasonal affective disorder is not listed as its own separate thing. It is actually a specifier that you can use when diagnosing major depressive disorder or bipolar disorder to specify that this disorder only happens during certain times of the year. Some of the symptoms can include depression, lack of motivation and energy, sleep problems, maybe hypersomnia, sleeping too much. Sometimes it causes changes in appetite or loss of appetite. And so the symptoms really are in line with typical depression symptoms. And so that is why it's under that category, and it's just used as a specifier to show this only happens during this time of year. It's really common. A lot of people deal with it. Some people don't know that that's what it is. A lot of times it's commonly called the winter blues, and we just blame it on the time change and that the days are so short. What may be happening is that when the days are that short, the weather is cold, we're inside a lot, we're not getting a lot of natural sunlight, and that can affect our internal clock. We all have what we call a circadian rhythm. We have a clock on the inside that pretty much keeps up with when different bodily functions need to happen. Like, when are we hungry? When do we get sleepy? When do we have to go to the bathroom? Like, all of those things, we have a clock internally that keeps up with that. And when the time changes and the days are short and it's like basically minimal sunlight, it can throw that system off, and our body doesn't really know what to do with that. And so chemically, it can affect hormones that kind of keep us feeling good. Those things can be affected and cause changes in our mood. In terms of when to seek treatment and diagnosis for seasonal affective disorder, I would say it's the same rule as with any other mental health disorder. When it becomes severe enough to where it's affecting how you function, it is getting in the way of things. You are not able to do the things that you normally would, or you have lost interest in doing things that you would normally enjoy doing. You're having to force yourself to do those things. You're not sleeping, you're not eating, or you're sleeping too much, or you're eating too much. It's affecting your mood in terms of feeling really down or feeling super irritable and cranky, maybe super anxious. Like, it's a problem when it becomes a problem. If it's just, I feel kind of down and things kind of suck right now, but I'm able to do all the things that I normally would, and it's not really affecting anything, we're not gonna make a problem unless there's a problem. And if you're not sure, if you're questioning whether this is serious enough, then that may be enough to just at least talk to someone and get an evaluation to see if it's really an issue or not. I say the rule of thumb is when the symptoms interfere with your daily life enough, then that's when you should seek a professional opinion to see what your options are, or if something more serious may be going on. In regard to management and treatment, the frontline treatment for seasonal affective disorder is light therapy. So like I said, we think one of the causes of it is that there is less sunlight this time of year that can throw your system off. Plus, when the weather is bad, we're not outside as much. So that's even less sunlight that we're getting because we're indoors more. So light therapy is basically simulated sunlight. Now, this is not like standing in front of the light bulb or the lamp. This is a specific type of light that mimics sunlight or natural light. I am not trained in light therapy. That is kind of the frontline treatment for seasonal affective disorder. Of course, medication is an option, just like it is for any other version of depression or bipolar disorder. Medication is not required for everyone, but for some people it is helpful in managing the chemical imbalance that might be going on and kind of keeping everything level, so medication obviously has to be prescribed by a medical provider. So if you think that's something you want to explore, you will need to speak to a professional. Also, therapy helps. Therapy helps with depression and bipolar disorder in general. So learning different ways to deal with life and all the things, learning different coping strategies, being able to identify how your thoughts are maybe leading you down the wrong path or contributing to the problem. All of those things are things that can be explored in therapy. And then also sometimes we just need a change of lifestyle. So if you are basically cocooning yourself and isolating yourself during the winter months because the weather is bad and the days are short, that might be something you want to think about changing. You might want to try to get outside more, even though the weather kind of sucks sometimes. You want to try to expose yourself to more natural light, exercising, eating right, all of the things that we would normally recommend for anything else, just good life stuff is stuff that's going to help with this disorder as well. You also want to make sure that you're maintaining a consistent schedule. So with the days being so short, it is easy to fall into kind of being less active and doing less things, and we kind of cut out things that maybe we would normally do because now it's dark at 5 o'clock. That's not recommended. If you're normally going to bed at 9 or 10, then you want to try to keep that schedule the same and find things to do that occupy your time to make sure that you're able to do that. You know, continue with your normal routine will help kind of keep your circadian rhythm on track and minimize these symptoms. Now, there are some ways to potentially avoid or prevent seasonal affective disorder. If you're going to do light therapy, maybe you want to start light therapy early. If you normally notice that this starts to set in around the time when the time changes, maybe you want to start light therapy before that time and see if that can kind of keep your levels the same throughout the season by starting that type of therapy earlier before winter actually sets in and the time changes. Also, staying active, making sure that you're building physical activity and different types of activities into your daily routine, and you want to keep that going throughout the winter months. If you got it like that, maybe you want to change your environment. Maybe you want to take a vacation to somewhere that's sunny and has warmer temperatures and longer days. If you got it like that, plan you a vacation in the wintertime to somewhere that's warm. So long story short, seasonal affective disorder kind of sucks, but it's totally treatable. There are lots of options, lots of ways to prevent it. What you really want to do is make sure that you're maintaining a steady and healthy routine. You are building in self-care. You are paying attention to what your body is trying to communicate to you, and you're giving it what it needs. And you're seeking professional help when needed. There are lots of treatment options, and so you can speak to a professional about what the different options are to find what options are going to work best for you. So if you have had experience with seasonal affective disorder or any other of the affective disorders, leave your tips and tricks in the comments below. Tell us what things have worked for you and how you have been able to navigate through these winter months to try to stay on track. Like the video if you like the video, subscribe and hit the bell notification so you don't miss an episode. This year my plan is to be posting every other week. As always, fear nothing, assume nothing, and take nothing for granted. All right, y'all, go be great.